Welcome everyone. I'm super excited to be sharing some information with you guys today. This will be about an hour-long presentation. We'll also send you the recording. I'm going to share some slides with you, and you're welcome to screenshot those for your own information. You're also welcome to share them on social media and tag us, me or Yoga Medicine, but I just ask that you not use them for other things. So, and I won't be sharing the PowerPoint. Sometimes people ask, but you can take the screenshots so that you've got those there. So let's get started. Let me share my screen with you because I have a lot of stuff to share. There we go. For those of you interested, this is just a tiny little segment pulled from our hip teacher training. So we have a full format training on the hip. I'll talk a little bit about that at the end. And that's more for teachers, although if you had a really deep interest in this or you're a healthcare provider, you might be interested in that as well. Just keep that in mind. Welcome, I'm Tiffany Cruikshank, for those of you who don't know already. This is one of my favorite things to talk about. I've been teaching for about 25 years, over 25 years now, I think. I've been seeing patients for almost 20 now. My undergrad is in pre-med and medicinal plant biology, and then my Chinese medicine degree is really my specialty, with a specialty in sports medicine and orthopedics. So our orthopedic modules are our core trainings, and such a really valuable, I think, part of being able to work with someone one-on-one therapeutically as a yoga teacher, or really any movement specialist. And so I love teaching this. I've trained thousands of teachers around the world. I worked at the Nike headquarters for a long time. I've had clinics in New York and LA and Portland and now Seattle. Worked with lots of athletes and thousands of patients over the years. So what I love doing is making this approachable, making it relevant, and making it impactful for the person I'm working with. So I'm really excited to share all of this information and talk about really the durability and somewhat injury prevention as a result of that. As we go through this, there's so many takeaways, and the hip is really such a special part of the body. And in many ways, it's kind of the seat of our experience in our body and our mind as well. I know it's usually one of the most requested topics or requested areas, I guess, in a yoga class, because we all know how good we feel when we work on the hips. And so not only a great one for our physical experience, but also I think you'll find too a lot of takeaways as you work through the hips to that anchoring of the mind and the effects there, which we are going to be focusing really more on the physical aspects and mechanical aspects of the practice. Obviously, keep in mind, there's so much more to what we do as yoga teachers, so much more. But just so that we can get in there nice and deep and get some deep information, we will be focusing on that and really understanding the inner workings of this joint and how to unlock its potential, which is what we talk a lot on in the training as well. For me, durability training is all about preparing the tissues to meet the challenges and demands of our daily lives. And so there is a little bit of this idea of injury prevention within there, though, you know, we know as humans, we can never completely prevent anything, but what we're trying to do is minimize injuries. We can injure ourselves doing a lot of things. And with this durability training, it helps us really make the tissues more resilient and also helps us minimize injuries. So we're going to talk, as mentioned in the newsletter or email that you got leading up to this when you signed up, we're going to talk about what I call the 3 pillars of durability. So those really important aspects of training the tissues for durability and resilience. And then we'll look at how our movement patterns can influence the neurocircuitry and tissue resilience and what that means. I realized that it said in the copy for longevity, but it should have been for tissue longevity, tissue resilience. So really will be all about the joint, and then how to apply this to yoga using some specific modalities, active movements, eccentric loading, and then I'll have a Q&A at the end. So let's talk about durability training and do a quick little overview. Keep in mind too that when we're talking about durability training, we're assuming that this is someone that doesn't have pain or really significant limitations in function. So we could go over really more of the details of that in the course. So I consider that more of the first initial therapeutic process of working with pain and significant limitations. Think about this durability training for people who don't, I mean, we all have things we're working on, of course, but people who don't have significant limitations or injuries that they're working with. I think of this as training for life or training for your sport. But before we get to that, let me just back up a little bit and talk about this therapeutic model from a big picture perspective here. So when there is dysfunction or when I'm coming back from an injury, there's a few kind of just general steps. Now, there's obviously a lot more to this when you're working with someone therapeutically, but the kind of general overview here is first, we want to be able to move the joint. And really what we're talking about is passively. We'll see this later on. In order to have a healthy joint, I also then need to be able to stabilize the joint in static positions. So that's usually, those two are usually approached simultaneously in the first part of the therapeutic program. Obviously, I would start with more non-weight bearing positions first, and then head into more weight bearing positions after that. But those, that first phase of static positions is going to be the place to begin. And then eventually, as I begin to be able to statically stabilize the joint in both non-weight bearing and weight bearing, then eventually I need to be able to control the joint movement, because that's what our lives entail, is movement. And so number three here is where we start to make it more fluid, the movement. We start to find a balance between stability and mobility. We look at transitions. We look at this balance of yin and yang, being able to both stabilize as well as mobilize, which is a very important balance that we want. Most of us kind of tend to lean more toward one side of that than the other when we come to this practice. And so trying to find some balance there. And then once we have that, once we can efficiently control the joint and movement, then we want to keep repeating that. So what we're trying to do there is create new automations for how the tissues support the joint, creating, I like to think of it as like a neurologic signature for the control of movement so that it becomes natural and automatic. And so in those second and third phases, we're kind of recreating some of those automations. And then I want to, in number 4, really repeat it to ingrain it in the system. And then number 5 is what we'll be talking about today too, is now this strength and coordination and balance. I start to increase speed. I start to maybe add some load and complexity there. And that's where I start to challenge the tissues and create some adaptations from that as well. So one thing to keep in mind too, before we get into the durability side, is just that when I'm applying load to tissues, I want to really have the right amount of load. And it's not, sometimes it can be tricky to find that perfect amount, but I always want to err on the safe side, on the gentler side, because if my load exceeds my capacity, I have injury. And if it's beneath, or equal to my capacity, if the amount that I load the tissues, so the weight I put on it, the resistance I put on it, if it's less than or equal to my capacity to meet that challenge, then I have the rehabilitation. Then I have that adaptations. I'm slowly increasing that load over time as my tissues start to adapt to create that resilience in the tissues. And so, it is that simple. I just want to make sure that I don't overload the tissues too quickly, but I do want to load them to create those changes in the tissues. And so, on that note, this one here, I'm not going to go over all of this, but I've just included it because I know some people like having extra notes and things. You're welcome to screenshot it and read through it. I think it's fairly self-explanatory. This is taken from my functional anatomy course, where we look more at the microscopic details of the fascia and the integrated anatomical systems and the research around it. But what I want you to see here is this third stage, this third stage, the remodeling stage. So initially we have an inflammatory phase, which is really important, it tends to get a bad rap, but this is what initiates that healing cascade, these healing events. And then we have a proliferation or repair phase, but notice that this one's just the first week. The next one's just the first month or two. The last one here, the remodeling, can be years. It can be 6 months. It could be a year or two. And all of these depend obviously on the health of the individual, the extent of the injury. So there's a lot of leeway here. And also how much I proactively do, especially in this third stage. Notice in that third stage that it says that this stage requires mechanical stimulus, and it's really susceptible to being interrupted, meaning that I don't load the tissues enough. So this repair process is halted. This is, if I'm not loading them enough, my cells there are listening to that. I'll talk to that in a moment. My fibroblasts are listening to that. And, in essence, saying, okay, well, we've met her needs here or his or there. We've met the tissue needs. If you're, on bed rest and not loading the tissues or just doing very gentle things, and they kind of stop that process if they're not being pushed to continue to adapt. And so this process, this last one, is really susceptible to either interruption, meaning we don't continue to progressively load the tissues, or failure, meaning we overload it. And most people kind of end up on one side of that. We just did a whole podcast on this, which probably won't be out for another month or so, but you can peek on the Yoga Medicine podcast. We'll talk more about these cycles here. But what's really important is that mechanical loading of the tissues. So when I'm talking about loading, I'm talking about usually in yoga using body weight as resistance for the tissues, that muscular challenge to the tissues. This phase can last a while. So think about the injuries that you've had potentially, and can also be susceptible to either non-completion or to failure, which if in the failure case, if I overload the tissues and irritate them, it kicks me back into that inflammatory cycle too, potentially. So the last one is the longest, and this one is so important for our loading and inputs to guide tissue repair. For a lot of people, this remodeling phase is where they actually maybe even potentially feel like injury is gone, depending on, again, the injury and the extent of injury. But this is where our body is still replacing. So if you look at this picture here in phase 1, the body's trying to heal up really quickly, and those fibroblasts are laying down type 3 collagen, which is a much weaker form of collagen. In stage 2, we start to replace those with type 1 collagen, which is the strong collagen that we want for tissue resilience. But in stage 3 is where a lot of that is really happening. So that loading is so important for the strength and resilience, and then also helping to minimize or prevent re-injury there, as well as create more resilience within the whole system. So just an important thing to keep in mind, that loading, those inputs that we create as far as challenges to the tissues, active challenges, are what are driving this remodeling phase that can last a long time. All right, so here's the 3 pillars we're going to talk about, the 3 pillars of durability training in a nutshell. The first one is that I do want to recapture any lost range of motion. So this one's the easiest one. We'll talk about this one the least, but this is usually the passive range of motion work that we're doing. And this really gives us the option for movement. If I don't have that passive range of motion, I don't have the capacity for movement within that. So it's kind of creating our capacity or option for movement there. The second phase then is recreating that neurocircuitry, those neurologic connections. So I want to start to reset those neurologic connections, and yoga is really great for this one because we have a lot of slow mindful movement. So we'll look at static stuff and isometric stuff, really simple things here to help recreate those automations we talked about. And then once I have done that, I've recreated those automations and I've repeated it, and now I've created those connections, eventually I want to expand that and start to challenge my tissue capacity. So challenging it with movement, I can load the tissues. Obviously in a fitness realm, that would be increasing weight potentially, but we have a lot of capacity to do that in yoga as well through body weight and depth of movement, speed of movement, complexity of movements. So now we're starting to challenge and strengthen those connections and capacity of the tissues. So let's talk about each one of those. The first one, like I said, is a little bit easier to wrap our heads around in a yoga sense, because I think yoga is kind of notorious for oftentimes miscategorized as being just for flexibility, but we know that it is very important for recapturing range of motion. And as far as we know to this point, sorry, my sound is off. I'm not sure why it's still making noises. My email's closed, the sound is off. I'm not really sure what that thinking is. But as far as we know at this point, because there's always more research coming out and there's so much research on stretching, but the majority of research suggests that passive range of motion is really the best for long-term range of motion gains. And so there was a big review that was out not that long ago that had implications saying that 1 minute, 5 times a week for each muscle group was the minimum needed to see long-term range of motion changes. So if you're just focusing on the hamstrings or another muscle group, you might find that one pose that helps you target that movement limitation. So maybe it's hip flexion or bending forward and touching your toes. And so it could be one simple pose done for 1 minute, 5 times a week. Again, that's the minimum. I think I prefer to do 2 minutes as the minimum, because I think a lot of people take some time just to relax into it, but it should be passive. So there's that relaxation in it as well. Now we also have things like PNF, so proprioceptive neuromuscular facilitation. If you're familiar with that, is just that resistance. So I'm using my hands to resist. So if you're in Baddha Konasana and we're trying to stretch the inner thighs, that one also hits the back of the hip, but let's say we're targeting the inner thighs, I'll put my hands on the top of my knees here and resist. I'm actively engaging those lengthening surfaces there, and then I'm relaxing back into the stretch. And the idea there is that I'm kind of clearing out some of that neurologic resistance and resetting that neurologic feedback. So that one is actually best just for acute gains. They're short-lived, but they help people get into some of those passive poses, which will get us the long-term gains. We know that MFR is a great one for range of motion, especially if there are restrictions. It also helps with gliding and hydration. But also keep in mind that the central nervous system can be important. If there's a lot of stress and tension, there can be sympathetic tissue tension as well, or neurologic resistance from that. So even simple restorative practices can be a way to influence range of motion for some people, and also eventually active range of motion. But really what we're trying to do in this first phase is recapture that lost range of motion. And I'll just plant a seed. We could probably go off on this topic for quite a bit, and we definitely talk about this in the HIP module, but it also brings up the question of how much is enough. And I think enough is in a big part about what is needed for your life, what you need to function in your sport and your life. And our hips, we actually do need quite a bit of mobility, like to sit and move around and be able to be free to articulate with our environment and our settings, to be able to sit down on the floor and be comfortable. The hips tend to be more stable and less mobile than something like the shoulder, which is very mobile and less stable. And so making sure that we recapture that range of motion is a really important part of this. Now, keep in mind, it doesn't mean that we have to wait to go to phase 2, but you can work on phase 1 and 2 together, especially if you're working on phase 1. If there's a lot of limitations and you're not making progress, I would definitely start to move on to phase 2 and add them in together. And so these steps don't need to be one and then the other. There's definitely some kind of bleed over in between them when we look at these 3 steps. So I definitely want to start with recapturing that range of motion. That doesn't mean I need to wait to move on, But for phase 2, I'm definitely going to want to be pretty strong in phase 2 before I start heading into phase 3, because I am going to incrementally increase that challenge. So, all right. Next, so let's talk about the second and third pillars here are really the big ones that I want to talk about within this. And so for the second phase, we're really looking at now using that range of motion that we've recaptured now, strengthening that neurocircuitry so that the tissues are working together as they should. We talk a lot about this in the hip training, that, you know, all of these muscles are designed to work as a community. It's rarely just one on its own. However, when there's dysfunction in the tissues, and one of those muscles is, I like this analogy, it's not completely accurate because nothing completely stops usually in the body, but if one of the muscles is kicking its feet up and taking some time off there, then the other tissues have to rise to the occasion to pick up the slack. And it's a pretty brilliant system in that way. We are built to be able to adapt and compensate. Sometimes those compensations are helpful and sometimes they're not, but it's built to be an efficient system. And so when all of the members of the community aren't doing their part, we lose some of that efficiency. And so when we start to back up, what we're doing here now is looking more at specific parts potentially of that system in order to help reconnect that neurologic feedback so that these start to become automated parts of the community again, meaning that we want all of the muscles doing their job in the appropriate timing. You don't need to overthink that. For our purposes today, what I want you to consider as a student, as kind of the experiential side of that, is that what that means to us is that maybe we want to focus on the things that are hard. And, you know, most of us tend to lean into the things that are easy. I know, like for me, pigeon's always been a really easy pose. I love that one because I can just come into it and take a little nap. Or, you know, the poses that you're really strong in and you feel really good in. Of course, we don't need to throw those away. However, what we really want to relish are the challenges. And, you know, if you're working one-on-one with a teacher or you're doing the full training, you might have very specific areas that you want to focus on for other therapeutic reasons. But in this phase, we're strengthening that neurocircuitry and these tissue adaptations through a few different techniques. And yoga is really great in this one. I'll talk about specifics in a moment, but I really love yoga for this phase because it really ideally involves a lot of slow, mindful movements here. And as we move more slowly and as we pay attention to the movements, we pay attention to what's difficult. We slow down when it's hard, when we start to lose our balance a little bit there. And it really helps the nervous system to actually collect more of this neurologic information. It creates these movement maps so that we're able to move more efficiently, more easily, as I have more of that neurologic input. So when we have more of the sensory information, so as we sense the world around us and within us, when we're moving slowly through this mindful movement, that sensory information, as I increase that sensory information, collection, it helps to better regulate my motor output or my movement function, performance, capacity, balance. And so as I start to embrace these slow, mindful movements in yoga, I'm naturally collecting more of that sensory information, which is enhancing my motor or movement outputs there. So that neurologic information is increasing my movement capacity and potentially my strength and power and performance. Now, what's interesting in this one here is that the fibroblasts, remember, those are the cells we talk about in the connective tissue, and the connective tissue is really the casing for the contractile apparatus of the muscles. So the muscles are just these contractile fibers that sit in the casing of the connective tissue, which is so important to hold the muscle in place and articulate it with the surrounding tissues. Those fibroblasts are really interesting because they respond to this loading. So as I load the tissues, the fibroblasts are holding on to the fibers of that connective tissue, the collagen fibers in particular, and then listening to that. So as I move and those fibers stretch or bend, the fibroblasts are listening to that information, and that loading becomes a communication mechanism with those cells that starts to translate into those adaptations that we see. So they are able to adapt through what's called mechanotransduction, which basically just means that that mechanical information, so the loading of the tissues, the movement of the tissues there, especially loading, that mechanical information or pressure or stimulation, they're able to turn it into electrochemical information, which causes those adaptations within the fibroblasts, is helping to regulate the production of collagen, which is ultimately what's creating the tissue strength there. So what's interesting about this connective tissue, and well, let me back up just briefly and say the newer idea now in sports medicine and orthopedics that's coming to light is that a lot of the injuries that we see are actually happening not in the muscle tissue, but actually in the connective tissue. There was a big article called "Is It All About the Fascia?" You can look it up, just type that in, by Jan Wilkie, end of 2019, I think. So really recently, he was looking at muscle strains, and I think it was 12% were in the muscle, and the rest was in different parts of the fascia, which would include the tendon. Remember, tendon is a type of fascia, or connective tissue is a type of connective tissue. Ligaments are a type of connective tissue. So most of the injuries we're looking at are happening in that connective tissue. So training these fibroblasts, these cells, is to lay down more collagen to create more resilience in the tissues is a very important thing. To just consider that this loading, as I use my body weight, think about loading as I simply start to bend forward. Now I'm loading these tissues on the backside of my body and asking them to rise to the occasion, especially if I go slowly. If I just fall under gravity, maybe not so much, but I am still loading them, right? There's still some pressure. They might not be as actively loaded as we might hope for. But what's interesting about the connective tissue and the fibroblasts is that there isn't a specific program in the body that tells it what to do. We are really helping these cells create those programs by directing our force appropriately. So our loading is influencing how those tissues are expressed, how the fibroblasts are expressed as well. So the first thing we want to do is make it really approachable, of course. So we'll look at using isometrics here in specific ranges of motion potentially, or maybe just the challenging ranges of motion, to enhance information within that specific movement. So it's really important that we have all of that neurologic information in all of these different ranges of motion, ideally. And the isometrics just help us drive more information through specific movements. Now, I guess I should back up. Isometrics, keep in mind, is the contraction of the tissues without movement. So I'm asking them to engage as I hold a pose. We do this a lot in yoga. You know, you're in triangle pose and maybe you're grounding down through that back leg and really activating that outer hip on the back leg potentially. So isometrics are found a lot in yoga and are a really great way to drive more information through that movement pathway. It's interesting too, because what we want to be able to do is train for all these different movements. We tend to think of an athlete as someone who's trained to do the exact same movement over and over. But the reality is that an athlete's actually trained, if you look at their biomechanics, to be able to execute all these slightly different options within that range of motion. Clearly I'm not a pitcher, but you can imagine. And to be able to really have that neurologic control of a lot of different options for movement. So, you know, even just in this one phase here, we can start to look at different, slightly different movements. So what we want to do is create neurologic pathways for all of the different challenges of our bodies. Our bodies, remember, are made to move in all the different directions. And even though in yoga, we tend to focus on specific alignment and setup, those are generally just the safest ones to begin with. And then from there, I'm able to expand and really control more ranges of motion. For instance, in Warrior pose, we love putting the knee over the ankle, which is really great for a lot of people, especially if there's knee issues there. However, in our daily life, we don't keep our knee over our ankle, nor do we need to, especially if you don't have a knee injury. And it's really important to load those tissues in different movements so that they are, again, creating more resilience and strength in that connective tissue. And so it's not that we need to be afraid of movements. It's just that we need to train for them and prepare for them. So what's brilliant about the connective tissue is that it's constantly adapting in response to demands of the tissue. So in response to that challenge. So as we take a step further here, we also want to look at creating stability within this second phase. We want to look at creating stability in static positions, and then be able to efficiently control that joint in movement. So as we looked at the beginning, we want to start with static, probably unloaded, so non-weight bearing, and then in weight bearing. For someone who's not injured, I might be able to progress through that pretty quickly. Again, and we're kind of talking about in this seminar, people who aren't injured. But if I'm challenged at this specific area, I might need to back up and take some weight off of it. So again, if you're a student or a teacher who's new to this, I don't need to overthink it, but I want to find the challenge and find a way to meet it, right? So I need to back up enough. Maybe that's weight bearing and static. Maybe it's non-weight bearing. Maybe it's heading right into some movement, but I want to be able to find a challenge that my body can meet. And so then I just want to keep repeating that until I create these new neurologic patterns. So isometrics are a great way to create these neurologic patterns. They're safe, they're accessible because they don't involve movement generally, although I'll show you some that do. And I can expand that into some movement and into some increased challenges. So this is a really great, simple place to live and work with first and not be in a hurry. So with isometrics, we do this a lot, again, in pretty much all of the poses. Basically, these are the cues that we're looking at when you or your teacher is telling you to engage certain parts of the body. I'm isometrically engaging in triangle. Again, I'm pushing down through that back leg. I might be knitting my front ribs back and rotating my torso there to engage that support through the core and that support through the outer hip. And maybe in certain practices, you're focusing on certain things more than others. And so you might be focusing on specific cues, or you might be focusing on some general cues that you always look at for a pose here. But those cues are really what are amplifying that isometric contraction, that ability to really contract and stay there. Now, just coming into an active yoga pose, not so much the passive ones, the yin ones, but the standing poses in particular, I'm isometrically engaging to some extent to stay there. But of course, we can amplify that through cues. We can amplify it through resistance. So I could come into Malasana, our low squat, and I could maybe put my hands on my outer knees and resist and push into it to help amplify that isometric abduction or separation of the legs. Or I could put my hands inside and resist to amplify that isometric engagement there. I think I taught one on YMO online. Recently, we were standing and we came into Utthita Hasta Panagustasana, so just standing with the leg over to the side. And I had people take their hand off of the foot. And again, I was standing, so it's a lot more active, and resist. So again, I'm isometrically, as I resist my arm and my leg here, isometrically engaging that inner hip there, so the inner thighs there. So there's a lot of different ways we can add isometrics. If you know you have an area that's challenging for you, you can find ways to tap into that in any class. You might find some poses are easier than others, but I'm sure that if there's one area of your hips that is challenging for you, that you can find ways to connect to that isometrically in a lot of different ways through practice. And again, I encourage you, if you're not working on anything specifically already, just to notice areas that are difficult or focus on areas that you know need a little bit more support. I can also hold at end range. Another way to isometrically challenge the tissues here would be to kind of passively come into my end range. Again, imagine that I'm standing. I guess I could stand here. You can see here. Imagine you're in Utthita Hasta Padangusthasana, holding your knee here to begin with. And then I can engage my core and my leg and my hip there and try and keep that as I take my hand away. Again, now I'm isometrically contracting to keep this shape. So I could hold it and engage. That could be an easier version and stay there and engage the standing leg and the core and all of the surroundings there, or I can amplify it a little bit and let go. And so you could do that I like to do that in figure 4 and take the bottom leg away, try and keep it in position. There's a lot of different ways to apply the isometrics, which is why I love them, because again, they're just driving more information through those neurologic pathways that are specific to that movement. So if you're working therapeutically, if you're a teacher, you can focus on known areas that are challenging or problematic. If you're a student or don't have specific limitations or issues, I'm just focusing on areas that are difficult for me and really looking for the challenges so that I can capture all of that information and be able to enhance that information as well. So I think I just figured out where that beeping's coming from. There we go, that should help. All right, so we've got the isometrics. Again, you can do that within a pose. You can resist in a pose. You can also use that if you're in a pose and then let go. So there's a few different options there. And then as I'm comfortable with those simple, more static isometrics, I can also use what I'm calling active range of motion. AROM is just active range of motion. So this more active movement here as I start to increase that challenge, but also still keep it really accessible. So once I've got that, once I'm happy with some of those isometrics, once I've got some grasp on that isometric information, then I can start to challenge it a little bit. Like I really love simple hip circles in tabletop. You can do them lying on your side. You can do them in down dog. But the key here that's really important, because we do this a lot in yoga where you're just mobilizing the hip, which is great just for circulation and movement there. But in this active range of motion, what I'm trying to do is go very slowly and go as far into my range of motion as possible. So if I'm in tabletop, I'll take that knee into the chest into flexion first, go as far as I can. Tabletop, I can't use my hands anyway, so it's guaranteed to be active. I'm going to take it over to the side as far as I can. I might rotate it in one direction as far as I can, and then I'm going to bring it back behind me into extension. Just trying to hit as many of those movements and just make a circle potentially there. Again, the key is trying to go slow enough that you can really go as far as you can. And what's beautiful about this is, unlike passive range of motion, where we can we need to be more cautious of being forceful and pushing ourselves into it. In this one, I can really push, unless you're having pain. Of course, if you're having pain, you want to back off if there's something else going on there. But in this one, I can really actively go as far as I can, and it should be really challenging there. The other important thing with these active movements here is that I also want to make sure that nothing else is moving. So there's no other compensation, so that I can be really specific to the joint that I'm trying to mobilize. So those hip circles are a great one. It can even be little things like working into hip extension. Maybe that's in tabletop if you're able to keep the pelvis in position there, and then making little circles with your foot at that end range of motion. So with the leg as high in the air as you can. So, and all of those details, you don't need to catch all of those. I'm adding those as just little extra points for teachers. What I really want you to grasp is the big picture, and I'll review all of that at the end. I'm just adding in a few side notes. I can also actively move in and out of poses. So that active range of motion, I can pull myself down actively again and slowly into low lunge or malasana. We do that a lot in yoga. That one's a common one, where you're standing with the feet wide and slowly coming down into malasana. Now I can just slowly lower, or I can also imagine isometrically resisting. So imagine if you were slowly lowering down into a squat or malasana there, Imagine if you were to go slow enough that you could imagine someone's hands on your thighs so that you were resisting and pushing up there, like you're pulling yourself actively into it, and then actively pushing through your feet to come back up out of it. You can do the same thing in low lunge. What else? Pigeon pose. I love just a slow little hover coming forward and then coming up. So you have to stay up a little higher with the hips, but hovering and folding forward, that could be an inch or two. It could be coming all the way forward. Figure four, not figure four, sorry, Malasana, low lunge. So there's a few options there. Again, full circles at your end range. I could go in one movement and make little circles in that end range of that specific motion. So it kind of just depends. I like doing the hip circles in tabletop where I'm going through the whole thing there as a warm up because I'm hitting all of it in a group class. It's really great because now I can hit all of those ranges of motion at once and notice that my pelvis isn't moving here, that it's really just my leg. I'm going pretty slow, though I could go slower. And a lot of it is really core, or I could do one specific one, like I said, coming into hip extension and then making, you're not going to see my foot, but making little circles there. Again, the key with this isometrics is going slow enough. You can imagine moving against some resistance. So even in that hip extension one, where I'm making little circles with my foot in tabletop, I'm imagining that my leg is like in a really thick sludge that I'm kind of having to push through. So I'm really trying to activate not just the hip extensors, but the whole hip and core and really everything that I can there, so that I get more of that neurologic information. So slow, conscious progression is really important. None of this should be painful, of course, but other than that, I can really actively work as deep into my range of motion as possible here. I don't have to be quite as, I don't have to be cautious so much like I would in a passive range of motion practice. So that is the second phase. And again, this one should be really simple, really approachable. Remember, we are trying to load and challenge the tissues. So don't be afraid of increasing that load at some point. Everyone's on a different side of this. Some people want to go too fast and some people want to wait too long. So it's kind of this check-in too, is where we come back to the yoga philosophy principles of being able to be non-judgmental, being able to be truthful with yourself, letting go of our ego, being content, so that I can really just see what's there, what's challenging, what do I need to focus on? Do I need to stay here or do I need to push further? Is this become easy for me? Do I need more of a challenge? You know, or is this still hard and I'm just getting too anxious to move forward? Because if I miss that simple neurologic information, it's not going to kick in when I'm more complex, when I add more challenge to it. And again, remember, if my capacity is not at least is less than my loading, I can irritate the tissues, right? If my capacity is greater than the load, then I have those adaptations. So I just want to be able to consciously load the tissues, apply these yogic principles of being content and being able to see clearly what is needed by letting go of our attachment, ego and judgment, and allowing ourselves to be immersed in the process and have this one pointed focus, this mindfulness to listen so that we can collect that sensory information. It's pretty brilliant, actually. A lot of the philosophy principles are also foundational for even this very mechanical physical practice as well. So slow, conscious progression, this mindfulness to create these new neural pathways and automations so that eventually it is more automatic there. And then once I'm feeling really comfortable with this sort of stuff, so again, I'm really looking for the areas that are challenging. You don't need to overthink this. If you're someone who is not injured, who feels very functional, who doesn't have poses that are really challenging, although I think everyone has some of that, whatever that might be. maybe you move on to the next step, or maybe this phase is really easy. But it's just, I think, interesting to make note of the fact that this is also just happening naturally within a yoga practice. So you are doing some of this. Don't be in a hurry, but if there are specific areas you want to work with, that can give you the first step. And then the next step that we want to look at is then challenging that. So once we have those automations recreated, we really want to challenge that tissue capacity. We want to speak to those fibroblasts and communicate with them and get them to adapt and create this nice, strong, organized collagen matrix that is resilient. And in order to do that, we have to challenge the tissues. And so when we look at this, we want to now expand that and apply a little bit more complexity potentially. So we can do this by increasing the load, which would mean our body weight on the tissues potentially. So how we leverage the body weight, meaning you could do chaturanga with the knees down, or you could do it with the knees up. I could also increase complexity and maybe change my arm variation here, maybe in chaturanga, or put one hand on a block. I could also increase speed over time. So that load, complexity, and speed are all factors that we can shift and change, not all at once, but one at a time, maybe eventually, and this is where we look at really elite level athlete training. We can pull a few of those levers at once the body is prepared for it. But we have to prepare the tissues there. And this is why we see, a lot of people jump into a yoga practice and start doing maybe lava vinyasa practice. And it's very common for chaturanga to be an issue because we do it a lot in the vinyasa practice. And to go from 0 to a lot, the tissues don't always love. Now, for some people that can be fine. The tissues adapt and they find their way. And for others, it might require backing up. And I think a lot of this is naturally built into our yoga practice. If it's challenging, put your knees down. We have modifications. And so it is important to embrace those modifications to allow the tissues to adapt and rise to the occasion instead of overloading them, and eventually build strength over time and resilience over time. So in order to challenge tissue capacity, again, those are the simple levers. But another one that's really interesting, and there's a lot of interesting research around this, is eccentrics. And eccentrics are just lengthening contractions. So anytime I'm lengthening a tissue as it's engaging, I think the easiest way to think about this is as I'm folding forward, and you can think of it in pyramid pose, Parsvottanasana here. So with one leg forward as I fold forward, you can think about this as I come into Uttanasana, as I'm lowering into a sun salute. You're not seeing my whole body, but I think you guys get the gist. The back of the legs there, of course, we're all familiar with this, the stretch that happens as we fold forward. The back of the legs is lengthening, but my tissues there are also actively engaging to slow that down. Now, if I just fall forward, of course, there's not going to be a lot of engagement through the back of the legs. But if I go slowly, now I'm really controlling that through the tissues of the back of the legs, contracting to slowly lower me down. Same thing in chaturanga. My triceps are contracting so that I don't face plant. So they're also lengthening the back. We know that as we bend the elbows, the triceps lengthening. It's also contracting to resist, eccentrically contracting to slow me down so that I can control that movement. So these eccentrics are a great way to challenge tissue capacity. And really one of the best ways to inform those fibroblasts. Now, best doesn't mean you need to do it first. It does need to be done in the proper timing. And what's important about these eccentrics is that this is also where we tend to get injured, is in the eccentric phases of the tissue, or kind of near our end range of motion too. And so what's important about that is that it means that we need to approach these with reverence and respect. But it also means that by training these eccentric motions, by training these kind of end ranges of motion, that we're also preparing the tissues and helping to prevent or minimize injury. And so a really important one once the other steps have been met, once the tissues are prepared to meet that challenge, that the eccentrics are a great way to load the tissues and have a really meaningful conversation with those fibroblasts as a way to have them lay down more connective tissue there. So these are great for performance enhancement, minimizing injuries. It is definitely an advanced option. These are advanced techniques for people with I'm going to put in quotes, normal range of motion, which is another conversation, but without significant limitations in range of motion or function. And really important, because what we're looking at is increasing the tissue's capacity to absorb force. These eccentric movements are really great to enhance collagen synthesis, which we know is so important for the health and strength and resilience of the tissues. It's also thought to increase what's called sarcomerogenesis. The sarcomeres are the structural unit of the muscle. And so the eccentrics are thought to actually add more sarcomeres along the length of the muscle fiber. So what it means is that we end up with longer, stronger muscle tissue. And so a really powerful thing too, as you can imagine, even these eccentrics can also potentially change our range of motion. But we want to be looking for some of that range of motion, recapture some of that range of motion before we get to the eccentrics too. These create those neurologic pathways for movement. Eccentrics are also used to increase the cytoskeleton, which are like the protein filaments that give the cells their shape and structure. And so it increases that strength and adaptation of the cellular matrix too, to help minimize injuries. And so we obviously enhance movement by controlling all of these ranges of motion, especially these eccentric phases where where injuries are most common. So a really important one when the time is right. But what's really important about the eccentrics here, and actually I have a whole series on Yoga Medicine Online called Strength and Resilience. I think there's 5 different ones that focus on different parts of the body, where we're really focusing on this slow eccentric training and some breath work while we're doing it, which is really nice because it leaves you feeling nice and calm and focused as well. But you can check that out for a lot of eccentric ideas and eccentric training. But what's really important here is that I want to actively engage that. So in the example of pyramid pose, so again, if I'm standing with one leg forward, imagine I'm starting from standing and I'm slowly lowering here. I'm loading those tissues. I do want to think about engaging the hamstrings in the back of that front leg, the tissues where I'm feeling the stretch. So when I'm doing these eccentrics, what I'm really focusing on specifically is engaging the tissues that are lengthening or stretching there, as well as the nearby tissues, as well as the core is always a great one biomechanically. It's the center of the body, so it's always helpful to as a supportive mechanism. But really, you could think of the whole leg, but I really definitely want to be engaging those stretching surfaces here. So I want to actively be coming in. You can imagine, again, folding into pyramid, I can do that more passively, or I can do it more actively. I can think about micro bending the knee and dragging that foot back. I like to think of it like a bicep curl for the hamstrings there, to really exaggerate that. So I really want it to be active, and I can slowly come down into it and then maybe bend the knee to come back out of it, or I can lower down and stay in that eccentric phase. I can pulse at that end range of motion. Now, again, the key is to start really easy. So like in the pyramid example, especially if I'm coming back from a hamstring injury, which at this point would be coming back, could be on the upswing, I might just come forward, lean forward a couple of inches to start with. And then over time, meaning weeks or months, I might be loading it more as I bend forward. The more I bend forward, so this is my hips here, my legs, my torso, the more I bend forward, the more I'm resisting gravity. So the more loading I have on these tissues here. And you'll feel that. It's pretty intuitive. So again, I want to actively engage the tissues. I want to find the right amount of loading. None of it should be painful. And then I can do repetitions, maybe with the breath like I love. I could pulse there at that end range of motion. But the key is if I want to target the one specific area, I want to make sure that it's just the one joint moving. So I want to make sure I'm not laying in my lower back. Instead, I want to keep a neutral spine and really stay active through the legs there, and go slow so that you have the opportunity to back off if you need to. So again, I think it's one thing we need to approach with reverence. Most of our injuries happen in this eccentric phase. However, there's a preciousness because of that. If we train this eccentric phase, we're preparing our body to meet more of a challenge in our daily life, which we know can be anything. We don't just move in these yoga positions when we leave our mat. And so we want to be prepared to meet the challenges of life and all the weird, awkward scenarios, especially if you have kids or animals or things you're chasing after, or an athlete. So I need to approach it in the proper timing, slowly with control and support and mindfulness, and then slowly increasing that load over time. Now, keep in mind too, if you're new to eccentrics, you will be sneakily sore. You might not feel like you're doing a ton at the beginning, but you will be sore if this is new to you. So just go, that's another reason why it's good to go gentle at first. Soreness isn't necessarily a bad thing, but you will have at least a little bit if you're new to it, which will change over time as your tissues get more comfortable with that. So think about all the times you use eccentrics in yoga. Sun salutations as we fold forward into Uttanasana. Again, if we are coming slowly with control, and again, we can maximize or magnify that by actively engaging the back of the legs, thinking about dragging the heels back or micro bending the knees, or just think about the bicep curl and the hamstrings. As I'm coming from warrior A and in sun salutation B, as I come from warrior A and lower my hands down to the floor, I'm eccentrically contracting now more of the glutes, potentially in that front leg. And again, you'll feel this. It's the tissues that are actively lengthening. So they feel like if you stayed there, you'd get tired, but you can also feel a little bit of a stretch there. Leaning back into standing pigeon as I squat back and sit down, and even Utkatasana. Lowering into triangle as an eccentric movement there. Really lowering into any fold could be an eccentric movement. It's not guaranteed, like especially in a yin practice, we're usually more passively coming into the poses, which is important for that phase. It's a whole nother conversation. But we could actively fold forward. What if we came into Upavishta Konasana with the legs wide and really actively lengthen the spine? We push down through the legs and we just hovered forward. That could be a great way to start to eccentrically challenge the hamstrings in the back of the legs there, or maybe a little through the inner thighs there. So there's a lot of different ways. I mentioned lowering down into pigeon too. I really love this one for eccentrically loading the external rotators as a way, if I'm hovering, I do want to lift the hips up a little bit. So I have some room to work with here, which is great. If you use a little prop under your hip, you can just take that prop out and stay there. So I'm pushing down through the legs to actively hold myself up and then hinging at the hips to fold forward. I call these little pigeon push-ups because I'm using my legs to lower up, lift up and lower down. There's so many. And again, you'll find a lot of those in that strength and resilience series. Oh, for the quads tend to be really resistant. I love eccentrics for the quads. One I probably see a lot in my classes are what I call Ustrasana leanbacks. So without the back bend, I'm just leaning back and I'm actively lengthening the quads. This one you feel right away. It's a great eccentric one to feel because I can feel my quads start to get tired right away, but I also feel them lengthening. So I can go nice and slow with the breath and really focus on the back swing because that's the eccentrics, and just come up quickly or all in one time, all in one swoop. So I'm really trying to focus on that lengthening phase to get into the eccentrics. Doesn't mean I need to move quickly coming out of it, but I'm just not focusing on it as much. Oh, there's so many great eccentrics. The more you play with this, if you're a teacher, the more and more you'll find. Again, I've got tons on that strength and resilience series. And it's important, again, to have that reverence and respect that this is quite a bit of a challenge to the tissues. So like in the Ustrasana leanbacks, I can just start by leaning back an inch, but I do want to have the tissues prepared to meet the challenge. So if you're a teacher, you know, this is why we start with the cues before we come into the pose. So in those Ustrasana leanbacks, I'm letting people know we're not doing the back bend. I'm engaging my core and really knitting my ribs back. I can push down through the shins there too to activate the quads. And so then it doesn't need to be a lot. The trick here is not overdoing it and allowing yourself to slowly increase that challenge over time. So here it is again. We've got the first phase is recapturing that range of motion. So this is more of the passive range of motion to create the option for movement. Then this kind of slow, mindful control isometrically, as well as kind of some of these smaller movements. So we're using those isometrics to enhance that sensory information to help enhance the motor control of the movement. So slow, small, simple isometrics there. And then the third one is increasing the challenge, again, with load, complexity, or speed. So in those transitions, as well as with eccentrics to really help strengthen the connections, the automations, my capacity, the resilience of the tissues to create a nice, strong, resilient, healthy, organized collagen matrix, because that loading of the tissues is also directing that collagen fiber orientation into this nice, orderly matrix, which is really important as well. So keep in mind, this is a brilliant, intelligent system that's constantly responding to demands. I think that's really important to remember. This isn't a fragile system. Now, of course, we can injure ourselves, and injuries happen. Injuries happen to us all. It can happen doing just simple things. It can happen, you know, doing sports or yoga or whatever that might be. But the system is pretty brilliant and designed to come back and designed to recover from that. The problem is that, as we looked at before, way back here, this remodeling cycle often gets interrupted, and we need this loading in order to direct that remodeling process. It's just about the right amount and the right time. So again, keep in mind, these aren't distinctly separate. You'll probably start with 1 and 2 together, but I definitely want to be really comfortable with some of this simple stuff in phase 2 before I really start to increase that challenge and go to eccentrics. If you play with eccentrics too, you'll find there are some that are really approachable and others that are definitely more challenging. So there's some gray area in between. But our mindful movements are really important to enhance this neurologic information. There's tons of ways to apply this in eccentrics and yoga. And if you're a student and not a teacher, just noticing the importance of those transitions, the importance of those moments where you can actively engage and create more support and slow down and take it in and relish in the challenge, knowing that that's where the adaptations come. So just really briefly, I know we're going a little bit over here. For those of you interested, this is the format of our hip training. So we just went to a little tidbit from this last section here. I just pulled a little bit out of that. We go into a lot more detail on the specifics because, as you can see, it's just a lot longer conversation. As a student, I think this probably plants plenty of seeds for you to just start chewing on in your practice and starting to kind of shift the preciousness and the value of some of the practices in your practice, some of the movements in your practice. But in the hip module, we start by really talking about the hip structure and function, looking at the bony structure and changes that can happen there, as well as the muscular structure, the joint structure, and all of the important features of that. Then we'll take you through how to conduct an evaluation to screen for changes in range of motion or function within the hip. In section 3, we'll talk about common injuries as a way to really understand what can go wrong, what tends to go wrong, and then also how to evaluate other injuries that come up, because there's all sorts of options But we talk about, what do we talk about? Osteoarthritis. We talk about tendinosis and tendinitis, labral tears, femoral acetabular impingement, FAI, dysplasia, others, impingement. Yes. So there's a lot of different things, but those are kind of the big ones that you'll see over and over. Then in section 4, we really dig into the therapeutic applications for the hip. So how to adjust for specific issues or specific areas from that evaluation. So the first step is doing the evaluation, so you know what to look at. And then in section 5, we'll look at pulling that all together, how to do the full evaluation, the flow of your work with someone one-on-one, how this feeds into sequencing and group classes. We'll talk about red flags at some point too, when to refer someone out, when to have them seek medical consultations. We talk about the fascial contributions and biotensegrity in the second one. I had to mention that too. And then in the last section, we talk deeper on what we talked about today. So active mobility training, challenging tissue capacity with eccentrics, myofascial chains, and kind of the interconnected whole and the reality of how everything works together. You'll also have case studies as examples, which really help to bring it to life. And we've got live office hours once a month so that you can ask your questions. You can do it at your own pace. What's brilliant too is that you have the videos to go back to anytime, and you've got practices along the way in each section to bring the content to life. So there's a lot of really valuable takeaways to yoga, to life, to health, to wellness. The hips are such an important part of how we feel in our bodies. We talk more about range of motion and how much is actually needed, different bone structures and fascial and muscular differences, to really support the individuality of the person in front of us, which is so important when we talk about therapeutics. So here's the core competencies. You can read through that, but we look at a lot of different things. I'll let you read through that for a second. I'm going to pull up the the course portal real quick so you can see it, and then we'll take some questions. You can screenshot that too if you want. But those are the core competencies and takeaways from the course. So if you were to sign up for the course, this is what it would look like, just so you can get an idea. I have all of them, so yours will just show the course that you've signed up to in this side panel here. And then this is the home page, which kind of tells you what's in each section, the office hour times, and a link for the office hour call. Suggested props, you don't need to have all of those, but those are some suggestions. And then again, some links to the manual and a discussion board for our calls. So you can post your questions to this discussion board and we bring them to the call. So if you can't make those calls, it's not a big deal. You just post your questions and you can watch the recording. Makes it really nice and accessible. So then once I'm ready, here's section 1. And each of these is a little drop down. So this is the first section. So there's a few intro videos there. You can see the list of videos. And then here's the hip lectures. And just notice there's a drop down here. So there's a few videos in each of these. There's a practice, at least one in each section. I think there's a couple. There's one asana practice and one what we call therapeutics applied, which is more of a therapeutic practice. It's not as active usually, depending on what we're studying at the moment. And then again, more lectures here. And then you can check them off along the way. There is homework for each section to help you retain the information. And then here's the recording. This is the recording from our call from last year, from the Zoom call. And then you can go on to the next section. And then just keep in mind when you're done in section 6, you will have a final exam. And once you take that and pass it, the hours log into your profile. They don't ever expire. So if you want to do the 500 hour, they're there for you anytime. You can print up a certificate or send it to Yoga Alliance. So that's that. All right. So there are lots of core competencies. You can see you walk away with a lot of information, being prepared to really work with the individual in front of you, being able to incorporate these concepts into group classes as well, being able to screen for individual limitations, and have a really deep knowledge of the therapeutic applications in a yoga setting in particular, as well as the fundamentals of just a very deep understanding of the anatomy and function of the tissues there. Joel, when I'm assuming you're talking about active range of motion, do we start small and get bigger? You don't necessarily need to. I think of the smaller range of motion as more just circulation and warming up the tissues. And so again, as long as there's not pain, if there's pain, I obviously want to back off, and kind of, if you're doing those circles, I often just kind of go around that painful spot or back off on that painful zone. I'm not pushing through pain, but for most people, I can start right at that end range of motion because I'm actively using it. So I have to be able to take myself into it. It's harder to push yourself too far there. So I'm starting at that full range of motion there. Let's see. Sorry, there's a bunch here. Will the hip training address knee issues? Since I understand knee issues actually can be related to the hip. We don't talk specifically about knee issues, but I will say from my experience, most of the time I'm working on people's hips for knee issues. The knee is kind of like the middle child, the middle joint here that is influenced definitely by feet as well. In my experience, I'd say 70% of the time, my focus is more on the hip. There are obviously some things you can do specifically for the knee, but I definitely want to look upstream to the issues in the hip as a foundational part of working with the knee. And you know what I often tell people who are working with clients with knee issues who are taking this hip course is to look at the hip first. And if you're finding anything stand out in that hip assessment, start there, because that'll probably be your biggest payoff there. When doing yin, finding more passive range of motion, is there reason to not go too deep to avoid injury or tissue irritation? I mean, I think this is a longer conversation. I love talking about yin, but I find, I mean, keep in mind collagen's very strong, especially that collagen type 1 that I talked about. If there's a really healthy connective tissue structure there, collagen type 1 is actually stronger than steel. So it's debatable and pretty difficult about actually being able to tear that with a passive stretch, but you can definitely irritate it. And I think in a yin practice, what's really important to me and in my experience is backing off a bit so that you're only at maybe 60 or 70% of your full range of motion. So it's a very gentle stretch because it also allows you to relax. It allows the nervous system to relax, to come down to, it allows the tissues to relax so that then I can start to work into it. And we get what's called the creep effect, which helps us kind of work into that range of motion there. A little bit longer story, but that's the gist of it. For people who have multiple training routines like plyo or heavy lifting, what specific adaptation techniques do you usually use to train their overused but likely weak tissues? I mean, I wouldn't use anything different. I would definitely use the same techniques. That's what's so interesting about this method, is that I'm using it regardless of whether it's someone who has really like a lot of strength training in their background and has a lot of those kind of large muscle groups that usually tend to be very robust. And a lot of times the smaller, deeper, what I call the mindfulness muscles tend to go a little bit more dormant. So I'm just looking at working on, regardless of the person, working on what's challenging. So if they're a strength training, lifting or strength training athlete, I'm still just looking at the weak links, regardless of who the person is. So same things. Difference between isometric versus eccentric movements. Great question. So isometric is static. So I'm engaging, but it's not creating any movement. So this is what we're doing when we're in triangle pose. I'm isometrically engaging tissues to hold me there. Otherwise, I just fall down to the ground. So something's engaging. I can amplify that by cueing some of those actively supportive tissues. But eccentric is talking to the muscles, is speaking to the muscles that are lengthening as they contract. So my outer hip muscles on the back leg are as my back foot in triangle, let's say, as I come into triangle with my right foot forward, my left foot is pushing into the ground to activate those outer hip muscles, glute med and the whole continuum there, to allow me to slowly lower into triangle. So that outer hip is lengthening, but it's also actively engaging, like the triceps. The triceps are lengthening in chaturanga because I'm bending my elbows, but they're also keeping me from falling on my face. So eccentric movements are lengthening movements. Our movements, and that's a distinguisher too, movements where the tissues are lengthening as they're contracting. I don't give out the PowerPoints, but you can screenshot any of those, Lori. We do talk about leg length differences. I will mention though that we talk about, if you're really looking at, usually with leg length differences, that's speaking more to the SI joint. And we do talk a little bit to the SI joint and the hip, but it actually ends up in the spine training. It's a hard one to decide sometimes which one to put things in. But the SI joint, the in-depth information on SI joint is in our spine training, which is also available to take online too. All of our online trainings are, for the most part, pre-recorded. So you have most of it recorded, but then we have the live, what we're calling office hours now, where you can come and ask questions. It just makes it easier for people to do it in their own time, since we have people all around the world, which is fun because then you learn from teachers all over and connect with teachers all over. We have live chat boards so that you guys can connect with each other. Our teachers will often meet up and have practice sessions or review sessions together. So there's definitely ways to connect with people throughout. It just makes it easier for you to do it at your own pace. Is isometric resistance the same as PNF? Well, PNF is a type of isometric resistance because in PNF, ideally, so in that butterfly scenario here, when we're doing PNF, I didn't go in depth on what PNF is because it's a little longer story, but again, if I'm trying to target the inner thighs in butterfly, imagine this is as far as I can go. So I'm relaxed there. I'm going to be pressing, but I'm trying not to move the legs so that I am creating an isometric contraction. But then I'm also just relaxing into the passive stretch. So I'm resisting, usually for 5 or 10 seconds. And then I'm relaxing into the stretch. I might do that a couple of times. Again, it's usually used as a way to clear out any neurologic resistance to help you ease into the passive static stretch there. So the more yin type of poses. So yes, they're similar there. Oh, yeah, some of these nutritional recommendations for hip injuries, that's a tough one. I think it really depends on the person. Nutrition is so specific to the person. Eccentric, and what's an eccentric movement for glute med? Triangle pose is a great one. Coming into, I love what I call triangle push-ups. I clearly like to use that phrase, but just really grounding down through that back leg there as I slowly lower. And what's important here is that I'm not turning, which is going to target more the back of the torso and the hip there, but I'm really thinking about my pelvis. It's not going to be perfectly aligned because, you know, just because of the joint structure, which we look at in the training, the pelvis doesn't perfectly tip, but I do want to really think about turning as much as possible with the foot and the knee forward here so that I really feel it in this outer hip. So I'm actively stamping down through this leg as I slowly lower into it here. And if I think about keeping my torso straight, I can be a little bit more specific to the hip rather than rounding the torso, which can have other purposes. That's what's beautiful about this, you know, really understanding the body is that you realize that it's not necessarily a right or wrong way to do a pose as much as just that there's different uses for all of these movements and purposes. Yes, you can do the course in your own time. We definitely talk more about, we talk a bit about neurodegenerative diseases in the nervous system one. I would definitely look at that one, Annie. Nervous system and restorative. So that would definitely be the place you want to look. Jewel, the $19 for a month for 3 months is for our yoga medicine online subscription. So that is the practice platform. So for students, I mentioned the strength and resilience series for the eccentric trainings. And there's a whole lot of other options in there too, speaking to the things that we've talked about today. But that was for people looking for a practice platform. So is there much overlap between the SI and hip trainings? Nikki, I wonder if you're talking about the short SI course on our site. We really just briefly talk about the SI joint and the hip training. I do speak to it, but it's brief. We have a short SI joint course on our site, which is really just the SI joint. And then we go into even more detail on the SI joint in the spine training. Hopefully that answers your question. Can you take the hip intensive if you haven't completed your teacher training? Oh, like a 200-hour. We've had a few people do that before. I mean, I think it is up to you. I do think it's helpful if you're in a 200-hour to, just for your own sake, clarity's sake, to complete that and then move on. We do have some people who are very enthusiastic. We've had maybe a handful of people who have started it before they've finished. If you're really enthusiastic, that can work. However, it's kind of your preference there. Yes, the yoga medicine trainings count toward Yoga Alliance continuing ed hours. And a lot of our courses do too. We call the courses on our site are usually the shorter ones. Anything less than 20 hours about. And then our longer ones, 20 hours and more, are on the teacher trainings page. But on the courses, just make sure you look to see that it says Yoga Alliance, because some of them are and some of them aren't. But all of the trainings, so the hip training, all of the full-length teacher trainings are, yes, are continuing ed hours for Yoga Alliance. I have my 500-hour that was heavy in anatomy. Can I start your next level, or do I have to do the 500-hour again for you? Oh, so for us, this is such a kind of a nitty-gritty detail, but here's the details. If you've done your 200-hour through someone else, and then you do our what we call a 500-hour, just because we've done that because I want it to be clear to the non-teachers, to the people who are looking to find a teacher, what your qualifications are. But if you haven't done your 200-hour through us, when you get the thing from Yoga Alliance, it'll say 300-hour. You're probably familiar with that. But on our site, as long as you show us a 200-hour certificate and you complete our 500-hour program, which is 300 hours on top of that, then we will call you a 500-hour teacher. Now, for the 1,000-hour training, it really is just referring to our hours. So we will acknowledge other 500 hours. So on our Find a Teacher site, you'll see people who have a 500-hour training next to their name, but are still in the process of doing ours. We have a lot of people who have done 500-hour trainings and then come to ours. The beauty of it, Lori, I think what you're asking is, do you have to do all the anatomy again? If you feel like the orthopedic courses aren't something you need, you can jump into whatever you want. Our platform really believes that, we believe in supporting our teachers to develop their skills in whatever direction they want. So some people want to go right into, the internal medicine modules, nervous system, women's health, or into specialties like athletes or whatnot. And so it is up to you to choose. However, just for clarity on our site, you wouldn't be a yoga medicine 1,000-hour teacher until you did the 200-hour. You can do anywhere. We count that from other places, but you would need to do it starts from there. So you would be starting your 500-hour with me. However, in your bio, if you have 500 hours from someone else and 300 from there, you can always say you have 1,000 hours of training. If you do, you just can't say you have 1,000 hours of yoga medicine training. So we just really wanted to be clear to people who are on our Find a Teacher site exactly what the teachers have completed with us, because that's all we can really vouch for. I know there's so many great teachers out there in trainings, and many of our teachers study with other teachers as well. And I encourage it, because what I love about this is our trainings really teach you how to understand kind of the backdrop. It kind of creates the backdrop of your understanding of the body, so that as you start to learn these different styles and approaches, you have a better understanding of how to use them and what might be helpful when, just by having a deeper understanding of the body. So I hope that answers your question, Lori. Yes and no, I guess, is the answer. Will modifications for hip replacement be covered? Yes, we talk about hip replacements. And I think that's most of the questions there. There were a few that I skipped that were a little more specific than what we have time for. But I got to all the ones that were really applicable, I think, hopefully, to this. In the case of hip popping, when lowering the leg down, I'm assuming while on your back, what can one look into when the abdomen is properly engaged and there's still popping? We do talk about this in the hip module. There's this little bony prominence called the iliopectineal prominence or eminence. And really, just for some people, it's a bony prominence that iliopsoas tendon can pop over. And for some people, it's just more prominent than others. And for some people, it's more on one side. For some people, it's on both sides. Really, for most people, it's not tender and it's not really problematic, other than being kind of annoying. And obviously, if you did it enough, it might irritate the tendon. You'd have to do it a lot, but a lot. But it's just annoying. So a lot of times, just how you rotate the leg or how low you lower it can help you avoid that, or just modifying too. Unfortunately, it is usually a bony issue, which doesn't go away. So I know I have it a little bit. Mine's not horrible. I can work around it, but I definitely have it a little bit more on one side than the other too. So, all right, I think I got all of them. My apologies if I missed one. I think I skipped one or two because it was a little longer than I had time to speak to. But hopefully that gives you guys a lot of information that you can work with if you're a student and feel into. Again, I love getting into the nitty-gritty of all the details of the hip, but you also don't need to overthink it. So if you're interested in this information, just start exploring it on your mat and in your practices. And you can check out some of those classes on Yoga Medicine Online for some more eccentric training that you can slowly work into, especially now that you have some really good information, although I do speak to it really quickly in the sessions. And if you're a teacher, you have a lot of tidbits, I think, to start thinking about already. And when you're ready for more, we're here for you. We always have more trainings and we're always working on new ones. So there's no rush. We're here. We've got your back if you want to learn. Otherwise, we've always got little free tidbits on social and on these little seminars that you can use to help support you. And on our podcast, we've got the Yoga Medicine podcast now for some free information. It's so important to me to be able to provide you guys with some free resources. And then for those who want more to dig in deeper, we have options for more if and when you want it. I hope that it's been helpful. It was lovely to see all of you from all around the world and those of you watching the recording. Thank you, teachers, for all of the work that you're doing out there, and healthcare providers, and stay in touch.